Welcome to Medical Monday with Summit Medical Group. I'm Dr. Reza Momini, board-certified plastic surgeon with hand expertise. So perhaps for months you've had numbness and tingling in your hands during the day when you work with them. Or maybe at night your hands get pain and cramps to keep you up and don't let you sleep. Could this be carpal tunnel syndrome? Carpal tunnel syndrome is pressure on the median nerve. Median nerve is one of the two main nerves in the hand. Usually, patients start to get pressure on the median nerve, which causes numbness and tingling. Typically starts with the thumb, or it goes into the next 2 or 3 fingers on the thumb side of the hand. No one really knows what the cause of carpal tunnel syndrome is, but we think that it's related to either some genetic components or perhaps some of the activities that we do during the day. Usually, people who do many things with their hands, either for hobby reasons or for professional reasons, are at higher risk of developing carpal tunnel syndrome. Typical examples are people who use a keyboard a lot, computer programmers, or people who use heavy equipment like jackhammer operators. But sometimes some professions that you wouldn't even think of tend to get carpal tunnel syndrome more often than others. Teachers often get carpal tunnel syndromes, or even dentists and surgeons. The usual way that we treat carpal tunnel syndrome starts with non-surgical options. Typically, a patient is asked to wear a splint at night so that their nerve is in a comfortable position, taking anti-inflammatory medications like ibuprofen or Aleve. And the third option is to give cortisone injections. And if none of those work, typically patients go on to have operations. Usually what we do is with the patient either under local anesthesia or asleep, depending on the preference of the patient, we make an incision in the palm, go down to the ligament that is causing pressure on the nerve, and release it by cutting it. The newer techniques involve putting in a camera so that we can accomplish exactly the same thing, but without having to open the palm. That's the area that's very sensitive. So when we avoid opening the palm and the incision is farther away in the forearm, patients find that the recovery time is much faster and they can get back to work and their daily activities much sooner.
Before, I couldn't sleep at night. I had problems all night long. I'd toss and turn. I'd get electrical shots up my arm, and it was just awful. So just coming here to the Summit Medical Group, to Dr. Momini, was the best thing I ever did.
This has been your Medical Monday with Summit Medical Group. Thanks for watching. Summit Medical Group is here to help you live well and stay well.